Good evening. This is Vicki Giannotti of the RLI, and I'm very pleased to welcome you to Module 3 for the Maximize Your Influence and Impact course. Tonight's session is Leading from the Middle with Dr. Geraldine McGinty. And a quick reminder regarding how to ask questions or comment during the session. You may either use the hand-raising icon, and we will then unmute your line, or you may type your question into the question pane found on your dashboard. We welcome your participation. And this is where we are in our schedule for the first week of Module 3. And this activity has been commercially supported by an educational grant from Philips Healthcare. And now I'd like to turn it over to Dr. Rubin.
Thanks very much, Vicki. Welcome, everybody, and welcome to some of the guests that we have this week for our extended discussion and extended program. We can't help but I'm sure everybody feel the impact of the pandemic that we're all living through, and undoubtedly the many varied experiences that everybody here has had over the last few weeks. And so it is really opportune that as we open the third module of this course, which focuses on influencing change at the hospital level, that we begin with Geraldine McGinty discussing leading from the middle, and in particular a focus on the impact that we as radiologists can make within our health system in a circumstance where we have clearly a very important role to play right now in this urgent health condition. So without further ado, I'm going to hand it over to Geraldine and look forward to everybody's engagement and some robust discussions and conversations. Geraldine, thank you.
Thank you, Jeff. Let me just make sure that I have control here. Not sure I have yet. And thank you. Yeah, we're delighted to have some guests. So yeah, my Leading from the Middle talk has definitely taken on a different tack with obviously the pandemic. And I think that we'll have some great conversations, as you said tonight, because I know that for many of you who are on the call, you are finding yourselves in rooms that you weren't in, with tasks that you didn't do before, and really potential opportunities to influence that maybe weren't always available to you. So let's just make sure. So I don't have any disclosures with regard to this activity. The learning objectives that we set originally certainly still stand. I mean, as Jeff said, in this module, we're really looking to help you build your influence. But I think what we really want to specifically focus on here is where many of you are. And let's be clear, everyone is a middle manager, even the Pope has a boss. But sometimes that role can feel a little constraining or frustrating. So we want to focus on some of the opportunities and understand how to build your brand. We'll talk a little bit more about that, but really want to focus on some of the stories that I know you'll be able to share with us about how you're optimizing your contribution, how you're finding a way to make a difference, and at a time when your organization may feel very different from the one you normally work in. And how is it that you can best contribute to a successful performance for your organization during a time of crisis like this? Okay, so I think we have a little bit of a delay. So the seed question that I sent out the last time I taught this was, I decided to change it, and I want to open it up to just really set the stage and get some of the stories from the front lines. What are the things that you've learned about communicating with your boss and your team as you're trying to do what you normally would do, tasked with doing, but perhaps some of the new responsibilities, just some top-level lessons that you've learned over the past few weeks?
So please feel free to raise your hand if you have some experiences to share.
So while we're waiting, Jeff, I'm going to say that one of the things I'm really learning with my team is the importance of communication in terms of trying to keep, and we'll talk more about this, trying to keep some of the informal communication. I've also really learned the importance of video. and really how that can make conversations more meaningful. But that for many of my colleagues, that's something new. I spend my life on conference calls, I think, but for many of my colleagues who are working from home for the first time, it can be uncomfortable. So trying to add some informality to our conversations so they're not all transactional has been very important. Do we have any volunteers?
We do. And first from James. James, please go ahead.
Yeah, so one of the things that I've come to realize is it seems like people really like communication, to Geraldine's point, but they also like communication about what's going on from somebody that they really know and interact with, especially in a time of crisis. So we have daily, very detailed updates from one of the major leaders of our hospital, and they're very informative. But despite that, I think we found that people just really want to hear directly from people that they know, from their division chiefs, from the COO of our outpatient practice, from the CFO of our outpatient practice. We even had our chair start giving twice weekly updates to our faculty members. And we've been kind of erring on the side of over communicating, but I think that so far that's been a good thing because it allows everybody to ask questions directly to somebody they feel comfortable asking questions to.
Thanks, Jake. And I think we're going to come back to that in terms of talking about some of the reading, which is the role of the middle manager in terms of translating. As you say, there's any number of places people can get information, but the middle manager, and we'll keep using that term even though it's really kind of not that pleasant, but it's that important role. As you say, if they know and trust you, it's going to make that communication much more effective. Thank you.
Anybody else? I would say that in our practice, it's very interesting that our teams have not traditionally used text messaging to communicate with one another. We've traditionally used email, but since this crisis has emerged, we're doing a lot of texting with one another. And it's been great to have the immediacy of that communication link. And it really illustrates the appropriateness of these different channels for communication given different scenarios.
Mm-hmm. Yeah, we just switched one of my team. We had switched a couple of our teams to Teams, Microsoft Teams. Sorry, shouldn't really give a vendor shout out here. But yes, that has a lot less of a formal feel than email, and seems to again be helping with that trust building around more virtual communication. Okay, we'll keep going, but really, we don't want everyone to be so quiet. We definitely want to have more conversation. So what do we mean by middle manager? Dilbert is always somebody to go to when you're looking for a somewhat cynical look at organizational structure. So what exactly does a middle manager do? The glue that binds the apathy to the vague objective. It's certainly something that can feel, that's good, I made my husband laugh there. It definitely can feel like this, right? You're not necessarily in the room where the real decisions are made. You aren't being asked to give input on organizational strategy, but yet you're probably the one that's going to have to take those decisions and execute them for the team that you're managing. So I think it can definitely feel like a frustrating place to be. And really, I think what we're really hoping to accomplish with this course is to have you have a sense of the fact that it's not necessarily such a dead end or such a frustrating place. So I did like this article because it was quite specific to healthcare, and I thought it took a quite tactical approach to what it is that actually the middle managers can do, and how they really are pivotal in the organization. Let me go back there. So it was really not necessarily saying that the structure was anything other than it is, but it was talking about the inherent benefit to the organization, this boundary spanning, and talking about the way that you can influence both up and down, or to senior leadership and the team that you manage. And, to go back to what Jake said, sorry, this delay is a little, okay. It was, so again, this idea that you can, because you've built trust with your team, you can help them synthesize, you can translate But I like the bottom one, that you can really, as a middle manager, be an absolutely key driver of innovation, because again, if your team trusts you, they will take those ideas that might feel uncomfortable. And we'll talk a little bit after the next, hopefully, discussion about what happens, if that doesn't go well. So I think, really having a sense that there's a unique role that middle managers play. And I agree with Jake. Obviously, we're in the same institution. Our senior leadership has been incredibly effective at communicating daily, and I feel like there's a lot of transparency, but there's something about distilling that information down to something that comes from the people you work with every day and that you trust. So a couple of, let's talk about a couple of questions from that. Let's start with, what is it that you've been able to learn from your organization's communications? How have you been able to translate that to your team? What is it that you feel that you've been able to uniquely achieve because of being in that position between senior leadership and the team that you manage? And let me just say, I think we have a lot of matrixed organizations right now. My teams that I work with don't actually report directly up to me, but clearly there are teams with whom you are working a lot. So don't get hung up on the fact that perhaps they don't report directly to you, especially if you're in a service line situation at a hospital.
Priya, please.
Yeah, so I lead the quantitative imaging lab at MD Anderson. So when we heard of the COVID virus, and basically we have these non-board certified radiologists who are doing the tumor metrics for us, which basically later on goes in to the radiologist to sign off. So we realized like they were the non-essential people, but however they were really taking care of the patients. So I made sure that they got workstations at home so they could still do their job from home. So basically they were safe from the virus at this point, and so I was able to make the transition for them. So the work went on, and we still have clinical trials. At that point, we still had the clinical trials ongoing, and the tumor metrics were done in a timely fashion at that point. So because I had the position and I was able to do it, I was also able to deploy workstation for basically non-radiologists at home to do their work.
So because you were closer to their work environment and
Yes.
really understood the unique benefit of their work, that might not have been as apparent to leadership.
Yes, that's correct, because nobody thought about them, because they were only thinking about the radiologists and the administrators, which were there in the hospital, but this was a different entity altogether, which was not in their radar. But I helped deploy the machines and got the work done. So I think they were not thinking about them when they were doing things for the other parts of the hospital.
Great. Thank you, Maria. Other comments? Thank you.
Yeah, from Mariella.
Hi. So I'm not exactly sure if I have any unique insight in terms of the position that I have. I recently took over directorship of quality and patient safety at my department, and the previous director, who has been just absolutely wonderful, and there's no way I could do this without his advice and his help. First of all, Davide, shout out if you're listening. But what I do know is recently I was in a conference, and when we returned, a few of my colleagues that are also friends holding leadership positions in some academic institutions here in Chicago, every so often we get together and we ask each other, what are you guys doing with the residents? What are you guys doing with your remote work reading stations? And I was actually surprised to see how in my institution, we were in a pretty good place in terms of, before this whole COVID started, we were already reading remotely when we took calls. So it was I felt pretty helpful giving them advice of some of the reasoning, and if they needed any argument to convince their chairpersons to just get some of the equipment to read remotely. So I felt that within a group of friends that we all held leadership positions, we were able to kind of put our heads together and share insights in terms of what are you residents doing? Are you sending your residents home? What are you guys doing reading remotely, if you are or not, etc. So I think to a different degree, I felt that there was some help and just ideas going around.
Perfect. Thank you, Mariella. Thank you.
Anybody else have any insights?
So I think we're going to talk more about the cultural impact of remote working, but I do think it's an obvious position of trust as a division director or residency director, where you're trying to make those kinds of decisions. And Mariella, you talked about both Mariella and Maria, and certainly there's a range of responses I think that people have to things like to change like that. And at a time like this where there's a lot of stress on the system, being able to translate your team members' individual concerns to leadership who may not know them and may not necessarily have seen them at their best. I think there's a clear value to, again, being that person that they trust to advocate for them. Okay.
I think it's worth emphasizing perhaps that this time in particular, when there's so much new information and new needs within a division or within any other team, that it is a tremendous opportunity for folks to establish their leadership and to strengthen the leadership relationships that they have with their team members as well as with the senior leaders. Because of all of the communication that's going on, it's an opportunity to really seize hold of the reins and communicate yourself, both with the division, to interpret what's coming from senior leadership that they might not be hearing, but that you're hearing, and to let your team know that you understand their needs, that you have their backs, that you really are advocating for them, but also to contextualize the stresses that are occurring upstream so that they best understand how the organization is working together. And on a day-to-day basis, these opportunities don't always come up so frequently. So it might be worth thinking about and asking yourselves, what can I do to do more of this kind of communication and essentially enhance my identity as a leader for my team and for the senior leaders? We have one other person who'd like to make a comment.
Great.
Melissa, please.
Hi, this is Melissa. Just like a quick question. I'm in between university jobs right now, but working for a startup in the meantime, where I have the opportunity to talk to 3 to 4 radiologists a day about in a recruitment type role. And the same thing has come up over the last 2 weeks in every single one of those conversations, which is that they've been asked to scale back and go on forced vacation or go on to furlough. They don't know if their practices are going to survive. They're not, there's a lot of uncertainty there. And I was just wondering if anybody else is seeing that out there, at the university level. I've heard that somewhat in mammography world. But also as a middle manager, how do you convey that type of a message, which is basically you're not going to get paid and you might not have a job for the next couple of months because of this to your staff?
Well, first of all, Melissa, that's really great insight. I would love to hear some questions. I mean, I will say at my own institution, we're clearly modeling out the financial impact of rescheduling elective exams. And I know that even though there's guidance from the CDC and from institutions like the college, not every institution has made that kind of decision. But be delighted to have people share what's happening in their own institution and how they are potentially managing those kinds of conversations if they're having them.
Oh, very good. Okay, Maria Gisela.
Hi. In our institution, what we've done is just that my group took a very active role in trying to guide the health system in the region and what to do with concerns with the issue about using CT or not using CT for the diagnosis, and just provide them with the guidance. So that was part one. The second part, it was that we all got together and each one of the sections decided which ones of the studies that were to be performed were things that needed to be, even if they were outpatients, that were more urgent than others to do it. And then to say like, okay, we're gonna try to do outpatients and we're going to delay them unless they're emergent for 4 to 6 weeks. And then the ones that were not emergent, they will be scheduled after that, because 6 weeks was sort of the time frame that was utilized by the institution as trying to defer the outpatients. But we still, some of the places do want to do some of the mammography in particular. So we're trying to limit the mammographers that are doing the procedures per se during the week and trying to rotate them into the different locations and have those scheduled procedures only one day a week in the different places so that we can limit the physicians that we're utilizing. So it's just trying to get hold and try to steer the scheduling and the radiology services in order to provide some that is needed.
Thank you, Maria Gisela. Is anybody, if you're comfortable sharing, is anybody having conversations around things like furloughs or forced vacation?
Faraz, make sure that you've unmuted your computer or your phone before you speak, or there you go.
Hi. So we've had essentially, we have about 102 radiologists in our group down in Houston area, and that's kind of what we've done is shifted around vacation. And initially we asked for volunteers. That didn't go over too well. We had one person, and then after that we just kind of went through a round robin and started assigning people some vacation during this time. I mean, it was just a matter of the hospitals we staffed about 10 hospitals and it just didn't need the staffing. So it was a decision about do we do this now, or do we, look for ways to reduce our salary burden?
And have you, Faraz, been the one that's had to communicate those kinds of decisions?
So, I'm part of the clinical governance group in our organization, but our head of our group, usually Waleed Adam, he's the one who usually has to have those difficult conversations.
Mm-hmm. Jeff, thank you very much, Faraz. Any other hands up?
Yes, we do. Maribel, make sure you've unmuted your phone or there you go. Let's see, we're not hearing you. So I'll tell you what, Maribel, I'm going to come back to you, okay? And please check your equipment and make sure everything's working okay, because we also have Priya who has a comment. Priya, make sure you've unmuted yourself. Okay, good.
So now since the workload has gone down since the initial COVID days, so we've also asked our team people in our team to go in and help screening the faculty when they're coming in for their temperature, ask them questions and all that. So it was kind of difficult because they said that they were not physicians. Some of them said that, and they said they had family members who were older, and it was kind of difficult because they don't have anything else to do. We requested them to go in and help with the screening, and that was a pretty difficult conversation because and a few of them went to HR saying that that was not their job and their duty.
Interesting. And how have you, both in terms of having the conversations with people that you work with day to day, but also how have you been engaged in leadership conversations about reporting back those kinds of activities or actions?
So, well, I mean, a couple of people who went to HR to talk about it. I mean, I just, well, I heard it from HR, and HR said that, well, I mean, they work in a hospital and it's their duty to help out when needed. And so I did talk with the staff, and I said that, I mean, they could have come and talked to me before going to HR directly. And I think it's really important in this time of urgency and national emergency that everybody helps out, because we have to remember that we all work in a medical center. I mean, we don't work in Office Depot, or we are not working in a cafeteria, you know, like we work in a hospital, and when the time arises, everybody needs to pitch in.
Thank you.
Can I ask you a question, Priya? And that
Yes.
is, I mean, I think this is really an interesting scenario. And the first question I wanted to ask you is whether the idea to have a radiologist participate in screening patients was one that came from outside of the department and was communicated to them externally, or whether you were approached to provide staff for that. Were you involved in the initial decision to reallocate the effort of the radiologist?
No, I was asked to reallocate the effort. I wasn't included when the decisions were being made. So I was just a messenger, and that's what I did. I just gave the message, but I don't think they liked the message at that point, because there was no work for these people at this current time. There's no work to do, and we just thought that we are not going to cut anybody's salaries. We are not going to send anybody on vacation. We are not going to lay off anybody, and so we were just reallocating them to do essential work at this point.
So obviously,
is there anything?
Sorry, Jeff, go ahead.
No, I was just going to one more question to you, Priya, and that is: is there anything in retrospect that you maybe wish that you had done differently, or would think that you would like to kind of take back and do over in terms of the communications that occurred right around that whole decision?
Well, I think what I would have done differently was I would have talked with them and told them, or sent them an email, or communicated with them, telling them that this was the plan and each one was going to be assigned at some point in time to do the screening, which is required by the institution. And if they would volunteer to help, and if not, then probably they would have to take PTO, you know, but that's what was communicated to us. But at this point, I don't think our institution has has made any decision to lay off anybody or to stop payment.
So
we have
really
one more hand.
The classic middle manager's dilemma, right? When you have a policy that you know is going to be challenging for people to take on board, and going back to this, what is the middle manager's unique role and unique value is to be able to translate those kinds of institutional decisions to something that is palatable for the team. And I think that, that sort of what I always think about for my team is helping them understand the why. And I especially have that challenge with my team, because they're not a clinical team, I have my team are finance and analytics people, and they're very much sort of back office. So I think it's always important for them to understand the why we're doing this. As you know, as you said, we're not working in a cafeteria, although obviously we have cafeteria workers who are equally important these days. But that they are critically important because it's the mission of the organization. But let's talk a little bit about what it feels like when you've been forced to actually implement a decision that you really don't believe in. And I think what the R School says is that middle managers have a very powerful ability to railroad or block initiatives because of their unique position of trust between leadership and the team, that they can be where innovation goes to die if they choose not to communicate leadership's message. So I wonder if anyone has any stories. Have you seen people who have chosen to negatively talk about leadership initiatives, or decide that they're not going to invest in those, and they're not going to invest in their capital to communicate them to the team?
We have one hand raised by Mariella before, and I see. Let's see. I think we're still having a little bit of trouble with your audio connection. There is a comment that was put in by Maria Gisela. So far, we have been able to let go anyone or furlough using sorry, I'm just trying to. So far, we have been able to let anyone go using vacation. They were already scheduled. Okay, so you've avoided furloughing, and you haven't had to make the difficult decisions. Anybody? Let's get back to Geraldine's question and the topic at hand. I see Maribel's hand popping up. Maribel, please, have you seen any bad behavior? And unmute your phone.
Okay, can you hear me?
Yes.
Okay, so I am in a private practice. It's all radiology, multi-specialty. And we decided, we went into a meeting, and it was mostly about the screening tests, especially mammography, screening lung CT. And the group decided that we will continue, but we will space the screening studies more. And when we are calling the patients, because we call them to make sure that they are coming, to let them know that they are free to reschedule if they feel that that's safer for them. At the same time, we have a screening group that the group decided to do as a committee, and we were part of it as doctors, that before they enter the building, they ask them a set of questions, and if it's safe, they enter. They have cough, but they haven't been exposed, whatever, they put a mask on. So the team of technologists, for instance, they don't know how to feel about it. We are asking them to use surgical masks and to change gowns with every patient. To use the gowns that we give the patients to them to protect them. But we all know that this is mostly placebo because the surgical masks they don't really have enough protection. So I am uncomfortable with that, but I haven't demonstrated that to them because this was a group choice, and we are just dealing with it. And this is just happened, and the volumes are going down. So where I live, we don't have many cases. So in that regard, it might be okay.
Thanks very much. Any other questions or comments, Jeff?
Yeah, let's give it another shot here with Mariella. Okay, Mariella, can you
hear me now?
Oh, we hear you. Yeah, fantastic. Okay, good work.
Okay, so this is a situation that, every day we have huddle meetings at 1 p.m. where the administrative director of the entire radiology department she convenes all of the modality directors, not faculty, all the modality directors, and myself as the quality director. I'm the only physician in the group. These meetings, I think, are amazing. They're very enlightening. Today, however, I was one-on-one with her, and the situation that was brought up was, well, there's a VP of radiology administration, then there is the director, which is the person I'm speaking with, and then we have modality-specific managers. When we have x-rays, portable studies are ordered in the ER, and we have been very careful and I think hyper aware of utilizing and appropriately utilizing and not being wasteful of our equipment, our masks. And we're trying to abide by the current guidelines as much as possible. I mean, not trying, we are abiding to the guidelines. To make a long story short, all of a sudden, some of the X-ray technologists are walking around the ER with N95 masks, and we're very short supply. There is no indication for them to be using them. The director discusses this with their, the administrative director discusses this with the modality director, and it comes to light that, well, I mean, I don't know where they are getting this. Well, apparently something that was not entirely accurate, that, you know, is the argument that we see. This goes up to the VP, and then now we have witnesses from the emergency room physicians and non-physicians where we continue to see technologists walking around with N95 masks, and one of our director, the director, the manager of the X-ray modality is the one that has pretty much held on to a few of the boxes of the N95 masks and distributed to some other technologists, setting a terrible example and precedent in the entire radiology department. So this is something that we are dealing with today, as a matter of fact, because it was the second instance where this individual was kind of caught red-handed, right? Telling everyone, oh no, absolutely, this is what we need to be doing, but on the other hand, the masks are being distributed. So this is something that I'm not entirely sure how to approach. Not that I have the authority to approach it in any way, but
so that's a tough one, isn't it? And obviously that middle manager is seeking to protect or advocate for the people that are on their team in direct contravention of organizational policy. So obviously, you know, I guess it sounds like you're sort of in a parallel reporting structure. Is there an organizational culture? You said it's just one manager. Is there an organizational culture that really can frame that person as an outlier?
Well, I think this is a very unique situation in the sense that, well, we haven't had an instance where people are kind of hoarding N95 masks because at some point we believe that we might need them. And let me keep this one because we might not have, you know, when we do need it for sure in 2 weeks when we foresee that the situation will be exponentially worse. So I do not know if this is a trend, if this has happened before. My understanding is it has not. And again, as the director of quality in a large hospital and an academic institution, I do not have, I mean, they do not, you know, I don't oversee them. I don't have authority over them. They are ancillary staff. They are, you know, technologists. So we work pretty much as a parallel, in a parallel form.
And possibly a parallel talk, Jeff, or is the matrix middle manager, because that obviously adds a whole other layer of complexity to this. Yeah. I think one that I always find to be telling of somebody who hasn't really understood their important role is when people refer to administrative leadership as they. They want us to, and I think it's a you know, poorly chosen and often well-intentioned attempt to sort of identify with your team. Do we have other comments, Seth?
We do, from Jay. you're unmuted.
Yeah, similar bad behavior involving PPE. So, just like many other institutions, we've been evolving with our policies on appropriate use of PPE. And in radiology, we've tried to stay in line with institutional guidance so that we could preserve it as much as possible. And as we're ramping down outpatient practice, we're still seeing a bunch of outpatients. And in our outpatient practice, we've had some radiologists that, despite guidance to the contrary, have been using masks. And they're using masks in their offices while they're reading cases. And then we have our technologists and our nurses who we're not distributing masks to, become very upset at that for good reason, because we do have, as radiologists, we have contact with patients, but usually it's the technologists and nurses that have even closer, more prolonged contact and are more at risk. And I think, each of us as physicians, we're setting an example. And when, it just sets the bad example, sends the wrong message, and it looks like the radiology department is prioritizing physicians over their faculty members, over their staff. So it's been a tough situation. It sounds like a lot of other people have had similar situations with this crisis. And, I think it's also an opportunity in the sense that you kind of learn very quickly kind of who you can depend on almost throughout the department.
I'm curious, before we had a conversation about forced furlough, requiring people to potentially take pay cuts in order to take time off, and that everybody was going to share in that, or there was essentially drawing of straws. And now we've heard how sometimes there's some people that aren't comfortable with the rules under this special crisis circumstance, and the difficulty of having them at work when they're not following the rules. Has anyone tried to combine these two sensibilities and issues and say, hey, if there's things about the rules that we're following now that you're not comfortable with, we have furlough opportunities so that you don't have to put yourself at risk, and to kind of help solve the problem by having the people at work who buy in and understand where the organization wants to go, and giving an opportunity for the people who aren't necessarily comfortable with that to stay on the sideline, of course, to not necessarily be paid during that time, as has been articulated. Anybody sort of tried to work through some kind of a blending of the priorities like that?
Well, Jeff, I want to ask you a question differently, because when we did the team session, we talked about the different types of people on your team. We talked about the agreeable givers, love them, right? We talked about the disagreeable takers. We hope we don't have too many of those. And we talked about the agreeable takers. But, I think one question I'd like to ask is are there people who've been disagreeable givers, people who have actually identified things that you needed to know? They're pain in your rear end, but, because you had built trust with them and because you listened to them, you were potentially able to make changes in your policy or in how you were operationalizing things. Anybody have any disagreeable givers that they've learned to love more?
No one's feeling it yet, but
Nobody's loving their disagreeable givers. Well, it's interesting. I think I'll say we're having a conversation at the ACR level about the appropriate use of CT. And, we have our experts, leaders in the field, people like Ella Kazaruni, who, are absolutely, very, very authoritative, are, completely in touch with the literature and what's happening. But then, we have people out in the community who are being faced with lack of testing, and, CT feels like a very, tangible way to get to more of an answer than you might have had before. And we all know that obviously negative CT doesn't rule out COVID and all that kind of. But what I've seen from our leadership, and Ella's been amazing because she's running ragged, trying to do webinars and provide guidance, I mean, today she had a call with one of our YPS leaders, Dan Ortiz, and his CMO. Small hospital in Georgia, 116 beds. They've got 45 COVID cases, and we were talking about this before the session. They had a choir director who was retiring from a church, and they had an event where people flew in, 750 people, and now 100 of them or so are infected. But she was more than willing to listen to Dan, who's been talking on Twitter and on our Engage platform about, like, this is not our reality. We do not have testing, and we have to do CT. So I think that, and I'm not saying Dan's disagreeable, he's certainly not, but I think really being open to those voices that might be telling you something that is different. You might not change what you're going to do, but that you'll be open to it. And again, I think it comes back over and over to the trust. And we're going to talk next about social capital. So let's actually move forward to that. So this notion of social capital, kind of one of the reasons I picked this article is it's because it's old. It's not about when we hear social these days, you think you kind of jump to social media. But it's from 2000 or 2001, and it really talks about that this is something that is a key investment that you need to make as a middle manager. And I think we've already heard it. We've already made the point, which is people talking about having difficult conversations, getting people to buy into difficult decisions. How you do that is, or how effectively you do that is, I think, largely based on how much capital you've invested in your team. And that's not to say that people don't make decisions, by sending out a mass email, but I think that, if you really want your team to be performing in a way that not only is reflective of your performance, but also contributes to the organization, then I think this is a really key thing to focus on. So this idea of how do we invest in this? What are the kinds of organizational structures? And I'm going to go through a few of these didactic slides because then we can open up the discussion again. But we're going to come back to this statement from the article, Volatility and Virtuality Erode Relationships, because if there's anything that we're dealing with right now, it's incredible volatility and a widespread shift to virtuality. So we're going to come back and talk about that. But I think, the third point there about the sort of continued investment in this and the time and the energy, the conversations that you must continue to have, and I would say I've been trying to replicate a lot of this with my team remotely, the good mornings, what's the weather like, the things that, that just are the oil that kind of facilitate the work that we do. So I think there's a lot of good tips in this article. We won't go through them too much, but some of these concepts about people being together, we've had to pull ourselves back in radiology to some of this, right? We know if any of you are familiar with our Imaging 3.0 initiative at the ACR, we had talked about Imaging 2.0 as being this sort of loss of community where we're reading remotely, reading PACS, facilitating that, and we often talked about the lack of ability to connect with our colleagues, that we didn't have the doctor's lounge that was sort of the traditional gathering place. And certainly I've seen some practices, I don't know if we've got anyone who's from one of those practices, who've actually made an investment, some radiology practice who've made an investment in someone in their group, because a lot of hospitals still do have doctor's lounges, someone in their group being in the doctor's lounge periodically, even one practice who's put a PACS workstation in the doctor's lounge, sort of just with the idea that, that's the way if someone has a question, you can look at a case while you're there. But, a lot of these points, I think, are thrown into stark relief in terms of the situation we're dealing with now. So, some of the examples in the paper, not letting people work at home until they've been with the organization for a certain period of time so that they can really absorb the culture, and thinking about some of the difficult decisions we just talked about in terms of, communicating change to people. doing that to somebody who you've never met is a different proposition than if you're doing it to somebody with whom you've actually built a relationship. I think another important thing that many of us are balancing right now is how do we facilitate the relationship and build that comfort level without being intrusive. And I think we're probably finding ourselves having much more intrusion into each other's lives. I know that for my team, many of whom are working from home for the first time, there's a lack of comfort level with showing their apartment. My team admin is literally sitting on her bed all day in her studio and doesn't necessarily feel comfortable with the fact that that's, her office space. So how do we understand that that's her office space so that we can make sure we can actually send her some kind of desk that she can sit at without being intrusive on her personal life? So I think that's a real balance that we have to strike. Sorry. So we're coming back to this trust, and I think that we talked about this in the team session. This idea that we really want to empower people to feel safe making decisions. That concept of psychological safety. Nordstrom's is obviously famous for their customer service, and really about using your judgment as long as you're focusing on the customer. But I think another thing is that you really do have to validate the behaviors you've said are important. And if you've told people they can take risks, you have to make sure that when they take those risks and when they inevitably occasionally fail or things don't go well, that you have to manage that in a way that makes them feel comfortable doing it again. So just a couple of other pieces from that article, talking, I think, about the fact that this has to feel authentic, that there are some basic fundamentals and I think we're probably all seeing this. We're focusing on some of the problems we've been having, but I think for most of us, what we're seeing is our communities really, really pulling together in this situation. Okay, so let's talk about some of the real challenges, and I think these, as I say, look very different now that we think about what we're dealing with the COVID crisis, right? So this notion that people are, what they mean by hoteling is that you're not going to show up to the same place every day, and I think exactly what Priya reported, that this can make people feel very, very uncomfortable, that they don't have a sense of, this is where I sit, this is what I do, I know who the people are that sit around me. So especially as we think about being redeployed, I think we should be very aware that that's uncomfortable for people. And the article talks about re-engineering, which I think when I went to business school was a very oft-used business term. The idea that you would look at a company and just decide to upend its organizational practices and just change things around with the goal of changing governance and changing structure to get better performance. And this article is pretty negative about that. But I think the third point is something that we will definitely come back to, is this notion of if we put all of our eggs in the basket of one leader, that's not necessarily going to get to the best performance. And we talked about this in the team session. We talked about the fact that people have to feel like they have the ability to contribute if the team is going to really perform. And then the last piece that talks about sort of hypocrisy, authenticity, we'll talk a little bit more about that, some of the investments that you make as a manager, it has to feel like that you do actually care. Just asking people about their weekend because something you've decided you need to do to tick a box is not necessarily going to work. And then one more point that's made in the article that I think is worth taking away is that anything taken to an extreme, right, can have a potential negative aspect. And you might say to yourself, well, if social capital is good, if it's good that I invest in my in my team, and we all know each other, we all like each other. If some is good, then more must be better. And there is a caution in the article that talks about, if really everybody feels like they are incredibly well culturally aligned, then you do risk groupthink. And I think that goes back to some of the discussions we had about diverse teams at the last session that I taught for you guys. Okay, so just skipped over a number of points in that article, but it is well worth reading. So let's take these one at a time, Jeff. If indeed these relationships that we make, not just with our team, quite frankly, but with peers across the organization. I'm always encouraging my team, especially the managers, to be having coffee or just a 15-minute conversation with other people in the organization that they have to deal with. You don't want to be asking somebody for something, especially if it's really important, and that to be the first conversation that you're having with them, right? So I'd be interested, to hear from people. Who are you working with? What relationships are you relying on to get stuff done now that you didn't expect, or that you didn't necessarily think would be so prominent in your work life?
Okay, great. Just a second, Dan. All right, Dan, you're live.
Can you hear me okay?
We do.
Hi, Dan.
Hi. So I think a lot of us are experiencing this, that our relationships with IT have become a lot more important. A lot of my colleagues are working from home. Some of them live quite a distance away. A lot of them are having difficulty with childcare. I don't have children, and I live close to campus. So I've been working in-house this week and most of last week. And a lot of my colleagues really hadn't thought about working from home because we enjoy working together in a team atmosphere. And so helping everybody get set up at home has become an important role for IT. Oddly, I am providing some of that support because our IT is stretched kind of thin. I'm also giving advice on childcare, which is probably a bad idea. But I think this additional stress is bringing a lot of us together, and we realize that a lot of the things that used to be annoyances we have to ignore in order to serve our patients the way we need to.
Thank you, Dan. I think I could say as a maxim that it is always a good idea to have a good relationship with IT. I think you're right. I think a lot of us are understanding that that's an important one right now. Other comments, Jeff?
Anyone else? Yes. Okay, good. Jay, just a moment. Okay, Jay, you're live.
Yeah, so we, just like a lot of other sections, we found that we've had a bunch of downtime, and we're also an academic institution, and we have residents to teach. And I've been going totally nuts, kind of crazy busy with all of this various planning in regards to this crisis, and I haven't had as much time for my division. And but I've been able to rely on other members of the division, specifically one who has taken the reins with educational efforts and totally revamped things. We have a lot of people working remotely, and we set up a very organized structure for education where the remote attending will Zoom in with the resident and show cases virtually, kind of like a virtual readout twice a day, and perform lectures. And all of that organization and all of the thought and finding all the cases, like really this particular person in the section really took the reins on. And it's really awesome to see that there are people that you can rely on, and discover that.
So Jake, let me ask you a follow-up question. When all this settles down, are you going to take that back, or are you going to leave that with that person?
No, I'm going to leave it, and I'm very happy to leave it. And I think that actually it's one of those things that is going to be better. You know, it's one of those things that I think that we should have done a long time ago, and I may have been too busy to do. And now that there are other people that have taken that initiative, I think we could really move forward, and hopefully even in the future move forward at a quicker pace.
Great, awesome, thanks. Other questions?
Crisis breeds opportunity.
Yeah.
Others? Any relationships external to the team or external to the department? People that find themselves meeting with the head of critical care or pulmonary medicine, head of emergency services, infection control. Oh, okay. Just a moment, Mariella.
Can you hear me?
Yes.
We hear you now.
Okay, great. So yes, that is actually a great point, because as of, I think last week, we had kind of a boiling point where some of the radiology reports had a verbiage that didn't sit well with our colleagues, clinicians from the emergency room. Some of our radiologists made some recommendations that, to say the least, the CMO wasn't happy about, and a barrage of emails ensued. The point is that in that situation, we realized that there was a huge divide between infectious disease, emergency room, and radiology. And not for lack of a good relationship, just because, well, I guess as radiology is more and more kind of silo, working in a void, rather, not in direct contact with our fellow clinicians, now more so that we are doing it remotely. I think there was a misconception that, well, here comes radiology say today, this is an unexpected finding on imaging, and therefore you guys have to make sure that you're testing this particular outpatient that has no symptoms for COVID, for example. That was the actual case that triggered the whole thing. This has prompted us to create or plan a webinar where we're getting chest radiologists from the fellow folks by academic institutions to come over. Also the director of infectious disease, again our administrative director for radiology, and our chairman, just to have a faculty meeting. Sorry.
It's okay.
Oh, sorry. So I was saying, right. So we're having this webinar where we're trying to put all of our heads together to see, we're here. How can we make your life, CD and ID, better or easier? How can we help you guys provide a service that is less burdensome or with less conflicting messaging or antagonism, or whatever you want to call it? How can we make that? And I feel pretty happy that we're able to do this, to get all of these people together in a large kind of conference, webinar, rather, to discuss this. I'm really excited about it. So yeah, so that's something that I'm excited.
It sounds like another thing that may survive the COVID crisis.
Yeah.
Anyone else, Jeff?
Not at the moment.
So I'll just share one thing that one of my teams does all the credentialing and enrollment for insurance companies, and one problem we've had as we send everyone to work from home is the only credentialing that we do on paper still is with Medicaid. So I've reached out to our government relations team, who I absolutely did not necessarily expect to be dealing with, and I'm trying to get them to help me influence New York State to change that to electronic. So I didn't, they're not somebody that I really interact with that much. I do obviously a lot of government relations work at the college, but not necessarily in my day job. So they've asked me to help them a couple of times, as requests for comments have come through, and I've always been tried to be helpful. Now I have a big issue because obviously I can't have my team going into the office. and they're willing to spend some of their capital for me with the New York State Department of Health. So that was not one I necessarily expected I was going to have to deal with. So I think we had one example of where perhaps the relationship wasn't going well. Has anybody found themselves sort of at the other end of that phone, and maybe, Dan, it's with IT, sort of trying to convince somebody who they've never met before that they need something, or a relationship you wish you'd perhaps invested in more? I think I shared at our team session the last time that certainly there's a relationship that we're dealing with one of our payers that, looking back, I think I could have probably built a little bit more social capital on. But I will say that even that one, which continues to be somewhat difficult, has been molded somewhat by the COVID crisis. I think it has thrown into sharp relief that we have a bigger thing to deal with than our differences on our negotiations. So actually, no, that wasn't here. That was the negotiations webinar I did. Yeah. So I think definitely having a crisis like this, as it was Rahm Emanuel who said, never let a crisis go to waste. So anybody want to share a story of a relationship they wish they'd invested in more, other than IT, which is definitely a ubiquitous one, I think. A couple of people talked about text, and that's obviously not typically a direct reporting situation for us. Anybody want to reflect at all on we heard a story about where that's clearly not. We've heard a couple of stories, quite honestly. One where perhaps the technologists were not necessarily adhering to organizational policy on PPE, and one where we had the physicians not necessarily behaving in the best way. Anybody else want to share any stories about where they've felt like maybe that relationship could be better? Okay, we can come back to that, Jeff. Let's talk about the last one, because I think realizing that we're all managing work from home, work with kids at home, figuring out how to keep the culture going, and going back to what the article said, that we're dealing with a very volatile situation, and now we're becoming increasingly virtual. Any tips that anyone wants to share about how they're making it work, either for themselves or for their team?
Okay, great. So Melissa, please tell us, make sure that you unmute on your end. Okay, you're good.
So the team I'm working with right now, we were supposed to be all together working during this time, but obviously that's not happening. So we set up virtual lunches every single day that people can optionally sign into, just to make sure that everybody touches base. And then my closest direct report, we meet every day for like 30 minutes and just do like a touch base, just to make sure that everything's still on track. And then we've actually leveraged like texting software, I think, pretty well, like a HIPAA compliant Slack, where there's like multiple channels now that have been built out, and people are basically communicating back and forth all day via that. So I think we've been able to leverage that pretty well.
Great, thank you.
That's great. Others?
I unfortunately have gotten myself into this Map My Run challenge with one of my team, where I am failing miserably as they are all kicking my butt with like number of steps done and number of calories burned. I don't know how to get out of it now.
You just tape your phone to someone's car.
I think I'm gonna have to, yeah.
Well, what is #WFH?
Working from home.
Thank you. Thank you. Sometimes the obvious eludes. Priya, you've got a comment, please.
So I have a research team, and basically we touch base every day virtually via emails, and we just realized doing research remotely is much more faster than sitting next to each other, because the two faculty, when they're reading the same images, one can pull it up on their workstation, the other one pulls it up on the other workstation, and we can assess these images and put in our non-biased opinions on an Excel sheet, So it's worked out very well. 3 of us are doing it at the same time, with another 4th person sitting there and showing us the images. So it was much more easier. So you're finding that I think working virtually, it's much, for certain cases, it's much more easier. I mean, I'm not a person who likes to work from home. I like to go in, I like to talk to people, and it's really difficult for me. But there are certain things which I think you can do virtually pretty well.
Great. So again, perhaps something that will inform your work life going forward. Okay. Well, let's move on. The last objective we had was talking about your own brand, and whether you watched the English office or the American one, there was a character in both of them, and I didn't really watch the American one. In the English one, he was called Gareth. He's this guy here. And, again, it can be a challenging place to be, because while you certainly want to be making sure that leadership understands your contribution, you are balancing translating their message with advocating for your team. So it certainly comes with a little bit of baggage in that sort of satire of office organization. So I think some of the things that I definitely want to get some input from the group, but we've already talked about this, the concept of how do we build social capital, and especially how do we build the kind of capital that we need perhaps beyond the obvious relationships. I think a constant process of networking, and clearly we're busy finding, carving that time out to meet with people who aren't necessarily in your day-to-day work is challenging, but I think well worth the investment, and certainly people who are not just your peers in the organization, but people who are doing the things that you hope that you're going to be doing in the future. So just making sure that you're always building your network in your organization. I think sometimes we do tend to think about networking as an external activity. I definitely think I've talked about this in various fora, really understanding what's important to your organization and what's important to your boss. I will say that my boss and I sort of started our roles in our physician organization around the same time. So I was fortunate to be in my role as he was articulating what his priorities were for his new role. And I've kept those, and I keep an eye on them, and always sort of try and match what I'm doing with what his goals are for the organization. I think, having an articulation of what it is that you're focusing on, what's the problem you're trying to solve, so that, people, branding is a little bit of a loaded term. But how I would reframe it for people who don't necessarily feel comfortable with the sort of Kim Kardashian version of it is to say, what is it that you want people to say about you when they're asked about you? So, what do they see you as doing in the organization? What do they see you as contributing? A couple of other things, and I think I think some of the stuff that we've heard people reflect on about what they've taken on, what they've done differently. I'm always looking for ways to build what our team does and build what our team is responsible for. Quite honestly, I'd rather get the additional mandate, responsibility, opportunity, and then advocate for the resources to do it than say no until I got the resources. We took on, for example, my team we only did credentialing for commercial payers. The opportunity was presented to us that perhaps we could do it for Medicare and Medicaid yes, that's an absolute yes, and it's a no-brainer because there's a lot of synergies. There's no way we should have had two separate departments doing it. And I always think we'll get the resources afterwards. And then the last one that I'm hoping we might get some stories is taking the hit for your team, because you have to make a decision as a middle manager when things don't go right, whether you are going to blame someone. I will say that not all of the examples we've seen from some of our public officials when challenged with some of their policies have been particularly inspiring about that. But I'm of the Harry Truman philosophy, the buck stops here. I would say you're responsible for your team's performance, and if it doesn't go well, that's your responsibility. So those are some of my reflections on building your brand. We will finish up by just getting a few more reflections. And I think two things I'd like us to focus on, Jeff. Definitely some lessons about what this crisis has taught you about your leadership style and perhaps what you want to do differently in future. And then I do want to finish up with talking about sort of how we memorialize some of these experiences, because I think definitely in the heat of the moment it can be easy to just let it all go and get back to normal. I think that people are going to have a lot of skills that they've learned, and we need to talk about how to make sure that those stay with you in terms of being that you're always going to be recognized for them. So we have 10 minutes or so left for any lessons. What has this crisis taught you?
Has anybody learned anything? Okay, good. Okay, that's. Oh, I sense the. Okay, good. The juice is flowing here. Faraz, please.
Hi.
There you go.
Yeah, I mean, just how unpredictable life is. I mean, our volumes were up like 15%, and we had to have people work extra for pay for whatever they were reading, and all of a sudden now all that's gone, and we're having to force people to go on vacation within the span of 3 weeks. It's affected everything across the board, where it's mammography, IR, diagnostics, everything. I mean, we already had people working from home, and it was so hard to hire people to read all the volume that was coming our way, and then all of a sudden, we hired a bunch of people, and then all of a sudden we don't know what to do.
Thank you. Unpredictability.
Okay, and Dan? Dan? You have your hand up? Maybe that was if Dan, raise your hand again if you got something. Otherwise, we'll go to Maria Gisela.
Yeah, just resilience and how you can really do things that you thought that you were not going to do, and try to not mold, but try to take some control of what you're given in order to move forward, and just support all the people that are in your organization in one way or another.
Thank you.
Dan, I just unmute your device. Okay, there you go. But we're not hearing you.
Can you hear me okay?
Oh, there you're coming in. Okay.
Sorry about that. What I've learned is how important the human contact that we have as a team, just in my section, with the residents, with the staff. I've kind of liked the fact that I can work from an office all by myself, and I always figured that was normal for radiology. And what I've learned from being shut in, when I'm not at work, is how important it is that we stay connected to each other.
Thank you.
Perfect. Has anyone considered that they might want to do some scenario planning or any kind of planning once things settle out, once the crisis is gone? Does anyone feel that it would be great to make some plans in case something else happens? Okay, Priya, please. Oh, unmute yourself.
Yeah.
There you
So I
go.
think it's really important, as you said, like we need to plan for this in the future. We always do hurricane planning. We have designated people coming in during the time of this crisis, during the hurricane. So I think there seems to be a crisis which I have not encountered before, but I think we might have to plan for this in the future. I mean, have to have things in place if things like that do happen. Well, like we don't even have enough masks to give our faculty, like when they're working. So, I mean, things like that, I mean, we need to plan for this. I think you're absolutely right.
Great. And while I am unmuting Mariella, I'll just mention that Jake wrote in that Geraldine is the scenario planning master.
Well, thank you, Jake. I had actually done a scenario planning exercise with our leadership and also a separate one with radiology, and sort of the long list of potential uncertainties that we had talked about with leadership definitely included, a significant communicable disease. So I think that as we looked at the sort of priorities that we distilled out of that to say, okay, what should we be doing now to prepare us? Of course, we were not going to be exactly prepared for this particular challenge, but there were things that we said that we needed to do, and they were largely around organizational culture. Quite honestly, they were about, our obviously fairly traditional academic federated practice with largely autonomous departments working more closely together. They were about optimizing our relationship with our hospital partner, and those have become really, I think, key to our response. We couldn't possibly have enough masks and ventilators for, and hopefully we will have enough. I'm sure we will, but that wasn't what the planning had to be. The planning had to be recognizing the cultural underpinnings that we needed to invest in to be prepared for something like this.
Mariella, you have your hand raised?
Yes. Can you hear me?
You do.
Oh, okay, great. I'm sorry, I for a second I thought you mentioned something about role playing. That's not what's happening here. No,
but if you have something to share.
No.
Okay.
Yeah, please.
Well, one of our colleagues is he's Italian, and he has many friends back in Italy that are right now going through this crisis. In all honesty, it's a crisis. And today we were just sharing some ideas of, actually it was mostly him, coming up with ideas of things that Italians are doing while presented with just the absolute lack of resources. We discussed ultrasound, which is really not, it's something that has been there's a lot of buzz about recently for testing for COVID, lung stuff. But they also talked about just the things that the Italian emergency room physicians are doing in the middle of the crisis. So one of my meetings today with the director, a few instances came to light where, for example, we have a pretty stringent screening of patients when they're approaching their imaging studies that haven't been canceled via the outpatient center. We give them a screening questionnaire where it's pretty standard cough, fever, and so forth. And we have caught 2 patients that have lied through all the questionnaires. Two patients did have cough. One of those patients also had congestive fever. And that was caught today, and I'm asking my director or the director of the department, how can we prevent this from A, happening again, B, if we can't prevent it from happening again because, well, there's nothing you can do if the patient is not being forthcoming with the information. But B, if you discover that the patient has been not truthful and the patient in fact has some potential checklist that makes it a patient under investigation potentially, how can we make sure that we safeguard the safety of our employees and all the future patients that will come in contact with the facility? So that was something that we really didn't discuss before. The idea didn't come up that we could be doing something different. What we're doing now is the nurse that will be placing the IV and interviewing the patient will also do a very basic set of vitals, temperature, etc. I'm not sure about potential hospitalization and so forth, but at least something to kind of conserve that Swiss cheese model where layers that we could potentially add that might not create a financial burden because, well, we have to think about, well, okay, we're not going to buy boxes and big boxes of thermometers, and how much is that going to cost, etc. So I think we were trying to get creative to find ways where we can protect the safety of our staff, and that's what something that happened today.
Thank you. Thanks for sharing that. So I'm actually going to answer the last question, Jeff, unless anybody has any additional words. I think what you're all going to be able to put on your CV when we're through this is I think you're going to talk about being leaders through uncertainty. You're going to talk about being leaders who develop your own resilience and build it in the teams that you work with. You're going to talk about being empathetic leaders who invest in connections and build trust. And I think that, those are the kinds of skills that you would probably have learned anyway, but I think have been certainly in terms of the intensity, I'm sure have been turned up. So I think that these are challenging times. I'd like to thank all of you for spending this evening with us. And I think the one I would go back to what Dan said, and I did a little video that we sent out today. Being connected with each other is clearly something that I think can be really sustaining for us. So let's keep that going, and certainly let's keep sharing what we're learning from this. So thank you.
Thank you, Geraldine, and thanks everybody. I know we didn't get to everybody's comments, but they were all terrific. We really appreciate your openness and willingness to share. Best of success to everybody as you navigate these next days until we're together again in a couple of weeks. Wish you all a good health to you and your families and the strength to deliver for the people that you love and for your teams. And look forward to seeing you again in a couple of weeks.
Thank you. Thank you all.